computer. Good. Hi guys, we're ready to go.
Hi.
Hello.
Hi.
Hi.
What did you guys want to talk about first today?
Do we want to review like the four-step treatment plan, like to get to the treatment plan?
Sure.
Mm-hmm.
That sounds good.
So I know I'm pretty sure the first step, in the reading it talked about like we have to talk about case conceptualization first to like determine that diagnosis.
Yes.
Yeah.
Yes. So, um, and case conceptualization is really getting it to narrow down, right?
Mm-hmm.
And gets to the treatment plan.
Yeah.
Yeah.
Well,
So
to
that you can get your
diagnoses.
diagnosis, because you get your diagnosis right off the bat so that you can
Yeah.
so that you can start planning around that diagnosis with your treatments and your goals and all that, right? So that's where you collect all the information, everything that you can on behaviors and moods and family history and every other kind of history and social and cultural, right? All that stuff, past counseling history, past medical history.
Okay.
They keep talking about the DSM providing dimensional information. And I kind of wanted to ask you guys about whether you thought it did that, because I actually wrote it down. It said dimensional approach. The DSM has both a categorical approach and a dimensional approach. And I thought, well, it seems just categorical to me. So categorical would be like there are distinct groups, and we're going down through the case conceptualization to choose that they are schizophrenic. But they also are saying that there's a dimensional approach, that it says that personality disorders represent maladaptive variants of personality traits that move and verge until it's like a rainbow to normality, like the spectrum. So here it's maladaptive, and here it's whatever normal is considered. And that's the whole dimension aspect. Are you seeing that in the DSM? Because I'm not sure that I'm seeing any dimension in their descriptions or anything. Like, what am
That's
I
a good
missing?
point. Yeah, that's a good point, Jenna. I think to me it's the very descriptive diagnosis, and I think they're looking at it dimensionally, but they're breaking it down into those very specific dimensions, kind of like, autism spectrum, and then all the little discrete things that you can break that into. So
Yeah.
maybe they had this big dimensional picture and it's not as obvious when we just read the DSM.
Is that what it is? So it's like, okay, you're either qualified for autism or you don't. Like, where's that imperceptible shift to normal? I mean, is it mild, moderate, or severe that they keep talking about? And then, if so, like, because we're talking about how all of this planning, as opposed to the diagnosis, we're going to get to that, and then that feeds treatment planning. Well, without that dimensional approach, how does it feed treatment planning? Like, how does knowing that somebody is autistic help you treatment plan?
I well, I think it's like important to know that because when you're writing, I mean, just for anyone that you're writing a treatment plan for, like you have to like they're not always gonna follow it. And I don't want to say that having autism is an excuse to not follow like that treatment plan, but the same time, I kind of think, it sometimes is because of the way their like brain doesn't work the same way like ours does. And you want to, depending on the spectrum, on what side of the spectrum they're on, is like it's going to help you determine, well, how intense are these goals going to be, or are we going to make them like simpler to start out at first? So I feel like it's not just autism. I mean, we need to know any diagnosis to be able to write a treatment plan that's going to work for that person in the best way.
The way that I saw it, like going off of what you said, is like the specific diagnosis, and then you would see which symptoms that the individual has and how those symptoms affect that individual, and in turn creating a treatment plan that would like effectively tailor to that individual personally, like what the symptoms.
Highlighting their symptoms.
Yeah, that's awesome. I like that.
Yeah.
You know what else? It could also be where they bring in all the things about culture, sex and gender, you know, tying in, is there like, you remember, what do they call that, where you have categories of malfunction or dysfunction that go across a lot of a lot of disorders? Remember they talked about that, like there's sleep could go across a lot of disorders, and there's suicidal ideation that could go across a lot of disorders. Maybe that adds dimension.
Yeah, it feels like how the way the DSM is set up, it's like a perfect ladder. Like it doesn't make sense sometimes, but then when you're reading it, you're like, you kind of see it a little bit. I don't know, like, because
Yeah.
anxiety's like right here, and then it goes to like PTSD, like all the trauma related, because those are kind of similar and they all kind of fall under anxiety, things like with depression, like similar symptoms. So it's really interesting. Back to Jenna, your question about that dimensionalism.
That's a good point. Yeah.
Could that be why they like even go as far as to say someone is like is it unspecified or other?
Mhm.
Is that, I'm thinking off the top of my head, is that,
Yeah,
am I saying
there's
it right?
specified eating disorder, all that.
That's
And
a really good point too. Yeah, broadens it.
Yeah,
Yes.
because maybe they're not showing like the level of severity, or they're not meeting all of the criteria that's
Mhm.
needed for a true diagnosis.
Yeah, kind of saying like this isn't the diagnosis, but these are the problems, and like then treatment plans, like those kind of go along with how to treat the diagnosis.
Should we like go to like the second step of
Case
the four-step
conceptualization.
treatment planning?
Oh, treatment planning. Yeah.
Of treatment plan.
To go back.
It was like the 4-step, it was like that pyramid.
Mm-hmm.
Okay, so yeah, so the pyramid is case conceptualization. So yep, so the
Yes.
problem identification, is that those are the ones you're talking about, thematic groupings, theoretical inferences, and narrowed inferences on the pyramid. Is that what you meant, Natalie?
Yeah, I believe so. It's like our activity 4.1,
4.1.
because we have to
Okay,
follow
should we
it
just go to
for
that? Let's just go to that.
we have to follow it for
Little
Naruto.
like blurb at some point where it says the elements of the standard treatment plan, and the first one is behaviorally defining the counseling concerns to be addressed. The second one is selecting achievable outcome goals, and then it's determining the treatment approach and therapeutic interventions, and then the last step is establishing how change will be measured.
Yeah, so we have to do that for Naruto.
Right.
Okay, so Naruto.
Naruto.
Yeah, so that's right. So this is the first element is exactly right. The problems to be addressed. So that's the first question. What are the problems that they chose to address in Naruto's plan?
Honestly, Naruto has so many problems.
I
I wrote them down. I got 15 problems that I was able
Or
to
guys?
as I was reading it, 'cause I was trying to like, I don't want to say guess, but I was trying to like think like, okay, what could this be,
out.
right? But as I was reading and I was going back and counting, I was like thinking, I cannot wait to see what this kid's diagnosis is. It's like what their plan is, because he had so many problems.
The issues. Yes. Who was
Um, But I think the first one listed, well, I wrote it, the first one listed was behavior, which seems to be like, I want to say the common theme among all 15 of his problems.
Mm-hmm. Yeah, the characteristics that are like with ADHD, like that's a whole thing, and then all the aggression, that's a whole nother thing, but kind of ties in with it all.
Yeah, I agree. ADHD and conduct disorder are the ones they chose to summarize what they thought was the most important of all those things that you just brought up. Mhm.
And for this phase, you would actually describe out the behaviors at this point. Like you would say, he acted aggressively by doing blah, blah, blah. And he, like, it's that specific is your take on it?
Yeah, I mean, they even
Okay.
were saying he's got poor math performance. I wrote it down.
Yeah.
Poor math performance. He doesn't do his homework when he doesn't want to.
Yeah.
Even to the point where like not just there were discussions with the teachers and the issues that they were having, but also at home where he like doesn't want to do chores. He's terrorizing the children in the neighborhood and like stealing their school books.
Mhm.
Yeah.
My favorite part was where they said that he uses his ninja powers on the other students.
Catch me.
He uses his ninja powers to terrorize the neighborhood.
He says that.
Do we
Oh.
think that like any part of this like could be like related, like his behavior to like the trauma though? Do you think that would have been any effect? Because it starts out by saying like how he was an orphan and
I
just
believe, yes.
Yeah.
Because he
there was
cried
like that demon
compulsively for a
fox
long
or
time.
Like,
Mhm.
I wanted to believe in that, but then, like, I'm sure that plays a very huge role, but it also said that this all started when he was like before 2 to 4 years old or something like that. So like he's still very young, like when he was orphaned and then like when he moved in with his foster parents and everything. So I'm not really sure like
Yeah.
exactly what kind of
And
effect that would have on him, but
jumping from house to house, not having like a regular parental figure definitely will like stir the pot with all of
right.
what's going on with how he's behaving for sure, I would think. But
It's those statistical categories that people likely fall in for each of those major themes: aggression, attention difficulties, right?
mm,
I guess I was quickly wondering in therapy, sorry, this sort of shoots to the end, but you know how at the end we talk about how do you plan to use this in your future counseling? I just had this quick thought, like, how much of that backstory do you spend time on versus what you're working with now? Because they did talk about, first you have to get them up to a functional state. That's the very first step in actual treatment planning. So that has very little to do with the whole backstory. I mean, it all cycles, but I
Yeah.
was just, sorry, thinking about
like
out
focus
loud
on
about,
now and
yeah,
then go back later. But yeah, definitely it'll depend on just like everyone's different approach. I mean, I would be the type to like really want to see that full picture, really focus on like at least a summary of like the background and then kind of go from there.
helps you work with an
One
insight.
Mm-hmm.
one thing I did notice when I was reading this is, which will probably is going to come up later, is that they notated that he was resistant to psychotropic medication. I don't know if you guys noticed that. And so, and like I said, we can bring this up, as we move through the steps, but I did notice that he was resistant to that.
Yeah, and that's important.
Mhm.
Yeah.
So
Um,
if you look at page 148, I think there's a I like that summary. I know they put in a few different kinds of summaries and we've got the inverted pyramid, but I like that one for this particular 4.1 exercise. It has the behavioral definition of the problems, and just like you guys were saying, they didn't seem to mention anything in there about the background. But then when you look underneath that at goals for change, one of them was improved self-esteem. And I really think that that's where they could delve into being rejected by his parents and by his entire village. And then that was a goal for ADHD, was to improve his self-esteem development. So I think that might have tied back in. And then also on CD, on the conduct disorder, it says resolve the core conflicts that contribute to aggressive feelings, thoughts, and behaviors. So that might be addressed in that one too. That
Where it leaks back in again, the background, you're saying?
yeah,
It
yeah.
shows up in
But
your
you're right,
goals.
because you're right in the definition of the problem. I was concerned there because they don't mention anything there. But I think that that's exactly what you were saying, Jenna. They just focused on what the problems were, but then the goals for change in order to get those problems resolved. That's when you'd have to start looking at what's causing them.
Right, well, that's what
And
Izzy was saying.
I think one of the goals
It's
of
important and it needs to be addressed somehow.
That's right, Izzy. Yep.
yeah, I feel like we need to look at the whole picture and honestly, even bouncing around from like family to family, I feel like we need to like try to find a way to get as most like foster family information that like we can. Like, how was he treated like in these homes? Because like that, it doesn't like really go into that. It just talks about his behaviors, but it's also like, is there a reason though? Like, is he, how, where is he like, like kids obviously like learn behaviors from somewhere, like usually. So I feel like even an option to look into would possibly like sitting down with the whole family and doing family therapy maybe, but
Absolutely.
Yeah.
that's just me. So
Yeah.
Yeah, because we don't know like if they're the reason why he's like terrorizing kids is maybe like at a family in like either school or the neighborhood. Maybe like there was kids that like bullied him, and then now he's like in a survival mode where moving to like place to place, like, oh, I have to be the one to like, do all these crazy things. That way I don't get messed with or anything like that. So
He's
yeah.
using coping
and
skills.
I'm sorry, I have to sidetrack for a minute because this makes me think. I'm pretty sure some of us when we were all in school, we all had that kid that did like the Naruto or Naruto, however it is, the run in the hallway. It's like that's what I'm thinking of. Like, oh, they do this. I was like, they have to run so they won't get bullied. Like, and that's like what I'm like thinking of. Like,
You
The
don't know
hit first mentality.
they put their hands behind their back.
yes.
God.
I love that kid run. My 4-year-old still runs like that. It's adorable.
It's like, how do they
Like
know
they
that works? You go faster.
Oh yeah, yeah.
Yes, we all had that kid with their backpack full of bag on that could just run at full speed through the hallways.
Mhm. Or just have like full meltdowns and
Universal.
So like
So
that's when Izzy, like when you talk about like, oh, maybe he's being bullied or something, that's what made me think of that. Like, oh, like, they're protecting themselves.
yeah,
I was
definitely.
also thinking though too, the chapter makes it one mention to, in my mind, applying this directly to real life and not to come off like a big old cynic, but they say counselors must become adept at brief counseling treatments,
oh, yes.
right? And I was like, well, there's a nod to real life. Sometimes you only get 6 sessions with Naruto, right? So,
Mhm.
and those 6 sessions include your assessment.
Mhm.
So what you might do ideally is very different from what you might have to do in actuality. So like, I completely agree that if you could do a whole back history, get some medical results, look at how he's functioning in different, gather data from multidisciplinary team type things, and then interview the family, do counseling there. But if you've got 6 sessions, basically you're just making him be able to function in society. Like
Mhm.
you got to skip straight to getting him up to the functioning level and ignore everything else if you
But
only have 6 sessions.
you mentioned that in the chapter at some point. I don't remember where it was, but it talked about like the necessity, improvement, and potentiality of like the treatment. So like the necessity would be like first, and that's where you would
Yeah.
basically just like take the steps to help your client function at like a day-to-day basis. So like they would do like their daily activities, like their daily chores, like
Yeah.
things you need to function day to day.
Not ideal if you have to leave it there, but
Mhm.
I get it that
Yeah,
sometimes
that's the reality.
yeah.
Because
Sometimes
that's what I thought the same thing, Jenna, too. I was like, well, unfortunately, like I wish, but like all the time, all the other people to see, like that would be a lot of work to do for
yeah,
like every single one. And you want to do that, obviously, but that's just
yeah,
not the reality. But
if you can.
if you can, definitely, especially.
So, the two like F codes that we're looking at is um the attention deficit and with combined presentation, and then the conduct disorder and child onset type. So I don't know if you guys want to like all go through and like just like say a goal that you would like add to his plan for like one of these for like a treatment goal.
Yeah, or one that you like that's down there. I like that idea, Natalie.
Yeah.
So I guess I'll start.
Yeah,
So
for it.
something that I have used for ADD is I've created goals where I want, it's like kind of like homework that they do like in sessions. It's like, all right, I want you to take 5 minutes to just do this activity and nothing else. And when that 5 minutes is up, like then like it's almost kind of reinforced. Like I do this with kids. Um, so they have to like follow that each session. And that's something that I like to do. And it helps them like being able to just focus on one thing for that short time period and that you can like build it up as you go on.
I like that. Cool.
That's awesome, Natalie.
I don't know if it's something like I would add necessarily, but I don't know, because he has so many problems. Um, I guess I was more so expecting to see a little bit more structure around like the interventions or like the measures. Like, I don't know. I'd probably be giving him like a count or something, you know, him having 2 to 3 positive experiences with other kids, you know, within a certain
I
amount of
like
time.
Yeah, I
Yeah.
like that
Um,
idea.
that. Hmm.
And then the second thing is this, even with this medication compliance, he's a kid, he's 9. So I mean, if he was resistant to it initially, I even before adding in the encouragement and reinforcing the medication compliance, I'd be more interested in why he was resistant to it before I started encouraging him.
Yeah.
Yeah, that's a good
A
point.
good point.
Yeah, he is 9. Like,
Yeah.
yeah, his parents are gonna help him like take his meds, but like it's kind of like a weird
Like,
responsibility.
does it
I
make
don't
you sick? Do you not like how it makes you feel? Is it,
Yeah.
you know, before
And
you
they're
start
so young.
encouraging this?
Yeah. Cause like it's hard to say like, oh, like what are you experiencing? Like what side effects are you experiencing? And he's like, I don't know. Like I just don't, I'm like not well. I want to like not pay attention in school. I don't know.
Right. Get more to
Uh,
the bottom of that.
Yeah. But yeah, I agree with that. Going off of that, like, yeah, figuring out why they're not wanting to be, or he's not wanting to take the medication, but then also like trying to figure out like, okay, well, what's an alternative like idea to that? Like the cognitive behavioral therapy. Um, and yeah, I like that idea.
I
Rated.
like that multi-component psychosocial intervention where they involved the home and the family. I really liked that because when, you're bringing up that maybe we don't have a lot of sessions and doing some education for the parents and doing some education for whoever works with him directly at the school. Maybe there's a counselor there you can work with, and then getting them to do some kinds of outcome measurements or some kinds of diary keeping where they're helping with to reinforce the behaviors that you're going over. But I think you're right, Jenna. I think that's going to be one of the things that's the most frustrating, especially when you see somebody that really needs help. And especially if you think that you could help them if you had a little bit more time. But maybe that's where you need to bring in, other resources or group therapies or,
Well, that's smart.
you
You're
know,
right. If you don't have the time to do it directly, use your resources. I like that.
Mhm.
I also like feel like it'd be beneficial for him to like if the counselor ran like any groups at the school,
huh,
like if there's like a friendship group, because I ran a friendship group and it was pretty successful because there was a lot of kids in there that were struggling to make friends or felt like they were being bullied. And it's like when you actually get to like sit down and you find common interests and you talk about like, oh, what's right and what's wrong, like is this funny? And it's like so hard with kids because they were like fourth graders and it's like, oh, is this funny if like someone like falls down the stairs? And the answer is no, even though like we might think it's like funny, but it depends. Or is it funny to, make fun of like someone for like losing a game? Like, so it's like stuff like that, talking about sportsmanship, what's funny versus what's not funny. So I feel like a group, like something like that would be beneficial for him, like as well, if that was like an option, like at his school.
Yeah. Yeah. Maybe he would connect with some of the other kids in a way that he hasn't done so far too, through those activities.
And it could address both of them, both problems, the ADHD and the conduct disorder. That would be helpful.
Yeah.
With a little
Yeah.
time.
I was thinking to address both. I would love to do some anchor dropping type activities to treatment for this kid to get him to get space between the feeling and his reaction to the feeling, because he's not identifying well enough, spending time with it, and then thinking about it. Like it's just feeling reaction. So like there's a bunch of different kinds of things, from Buddhist type things to more behavioral approaches to getting you to understand, is it in my head, is it in my heart, is it in my stomach? I'm going to be with this feeling for a little bit. I'm going to think about it, name it, and then I'm going to think about how to react to it. Like if you could start training him on some of those approaches, that would work or be helpful, not work like a magic panacea, but be helpful for both the attention and the aggression.
Mhm. Yeah, I agree.
Relaxation, stop, look, and listen.
Yeah, exactly.
Does anyone else have any other thoughts?
Even incorporating like art therapies, because it said that he did really well with like artistic expression and that he would pay attention during those times. So like, doing like activities such as like paint,
Yeah.
like helping him work.
Yeah, I feel like having like moderated like art therapy activities, like even just like having like it could just be like splatter paint. Like I just want you to just like paint like your feelings in an appropriate way. Like as long as he's like not painting like anything violent or aggressive, but it's just like if the whole painting's like red and black, because then like stuff like
But still, that's a great idea, Swar, because it's working from his strengths, which we haven't addressed yet.
Yeah,
So that's vitally important. You picked the one thing that we didn't do at all. We've only looked at all of his bad stuff, whereas you picked the one positive thing. So good work there, man.
Like that. Hmm.
yeah, that was great.
The outcome measures of change, that was the last thing they asked about.
Mhm.
That's on page 150.
so I guess what we expect the outcome to be for him.
Yeah, and how you measure success. So apparently, getting back to the comments that a bunch of us have been making about how you end up being accountable to like maybe an insurance company, and they want to be able to measure the success that you've had or not had. And so how do you measure your success? How do you measure the change?
Which is why it's so important to start with those behavioral at the very beginning, because otherwise
Exactly.
you can't measure it. So yeah, and then it would just be little steps that you think he could manage and get reward for at the
I
beginning.
feel like you would have to like take notes like each session, like from that first session and all like the behavioral issues, and then see if there was a decrease like throughout the next sessions after you keep like doing that like homework either in session or outside of it.
Yeah, I think Jenna had mentioned something about like a diary, keeping track of like a diary of, I forget, it wouldn't all happen so fast, but I remember I think it was you that mentioned something like that, and having, if like, for instance, if we met with like their school counselor, or like we were doing like work together with that, maybe they could write down notes like, oh, like he was able to pay attention for like an hour on the math, like, and then had this, but then we were able to like focus on that, like achieve a little goal.
I like that. Numbers.
Mhm.
1
Yeah.
hour, and then he was able to do more.
Frequency,
By time.
duration.
More longer,
I
maybe.
think another way is like within that like diary or journal, like, you could track if you start talking, oh, well, Naruto, like, why did this make you angry in the first session compared to was he able to give a reason, or was he just like because compared to like the next session, did it help? Was he able to be like, well, someone was bullying me at school today and they wouldn't stop?
Yeah, that's good too. I
Yeah.
like that.
Yeah.
It's true.
Qualitative measures too, that he seems better. They're harder to describe and harder to measure, but I think that they are more descriptive.
Mm-hmm.
Uh,
I think even like teacher evaluations, I think they mentioned that in there, but just having them like go through every week and being like, oh, he did really well on this week, and then he could probably improve on this, or I think that's a great way to like track progress, especially academically, if he's like having trouble learning or like staying still, or like, you know what I mean?
Yeah,
Mhm.
absolutely. And it
That's
probably
great.
helps the teachers feel heard so
Mhm.
that they're not frustrated with him. I just see it greasing the wheels all the way around, if that makes sense. They're more likely to put up with him because something's being done and they're part of something being done and they're getting reinforcement for their work from you and
And I mean, you could
so on.
even kind of have like a prize economy there. Like, I wouldn't say like almost like a token system, I guess, but in your sessions, you could be like, if you can tell me 3 things, give me 3 things that made you upset this week, and then give me 3 ways that you were able to come out of it, like 3 ways that you calmed yourself down. And then, like, maybe you could give him like an extra prize at the end,
Yeah.
like for being able to communicate that.
Yeah.
Yeah, because they're young. Can't
Reinforcement.
thing.
Yeah, kids love prize boxes for anyone in their future practice. Like, if you work with kids, like, make sure you have a prize box or you have candy. That's the only way they'll talk to you.
Hell, I love prize boxes.
Yeah, exactly. Is
Um,
that everything that we need to talk about the activity? Should we move to DSM or do we need to?
yeah. How do we do with the activity?
I feel
I
like we
think we did great. I think
Yeah.
we did great. I think, in fact, when looking at the outcome measures of change that they had in his case study, I actually think you guys came up with some better ones, because the ones that are here are really good, but they don't have any measurements on them, or it's hard to see measurements. Whereas, you guys talked about frequency and duration, how long it lasted. Was it an hour? Severity. And maybe even sometimes putting a number on that for insurance purposes, or to just help you measure progress. I think that that's awesome. I think we did a
Also, we
great
can
job.
graduate now. We're done.
We know
Let's
every.
start a practice.
I still think that last one, that compliance with um I wrote it in my notes, something about psychopharmacotherapy.
Oh,
Still don't
yes.
agree with that.
Yes. Yeah.
Yeah, I still don't
Especially
agree with
since he
that.
already had an opinion. Good point.
Yeah.
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 All right, should we talk about the DSM now, those
Yeah,
readings?
let's do it.
Yay.
Which one do you want to start with?
No, we're focusing on the eating, the sleep wake, right? Sleep disorders.
Which
Which-
one do you want to do first?
I thought the sleep disorders were really interesting. Going through it, I was like, oh my gosh, like I kind of forget that there's so many problems you can be affected with your sleep. And I don't just reading all of them, I was just like, oh my gosh, like
I know it
sleep
got
is so important to me. I
overwhelming.
can't imagine not sleeping.
That's like literally me, like every week reading these. I'm like, there's so many problems people could have.
No, I'm just like, God bless them. Like, I want to be able to go to sleep and not, I mean, I deal with like nightmares, but then like the not being like just staying awake and like that stresses me too. Cause I mean, I can barely function with like not having the right amount of sleep. I've discovered I need more sleep. I always thought it was like 5 hours was kind of good. I don't know. It just depends, obviously, now when you get older too as well. But
Oh yeah, girl, I need 8 or 9.
that's how I feel now. I never thought. Now I'm like, oh, 8, like,
Yeah. Yeah.
I
Yeah.
can like survive off of like 4 or 5, but then it like starts getting later in the day and I like need to go to bed at 7.
mhm.
Like, I'm not even gonna lie to you guys. I love sleeping. I could go to sleep right now.
Sure. But yeah, reading all of those, I'm trying to go back to it now with all of them because I kind of,
Yeah.
I
And they
wrote-
ranked everything. There was like the apnea kind, where there's some sort of obstruction, all the
yeah,
way through to just circadian rhythm type things. Like if you live in Alaska and you have too much daylight or too much dark. So it was really a breadth of a spectrum of possible things that could go wrong. It started to get overwhelming.
yeah.
One that I
Especially
found
like snoring, can't
Yeah.
breathe.
thing I
Gosh.
think was like the substance and medication induced one, because like
Mm.
obviously like medications and substances like they have many side effects, and like they'll affect your body in different ways, but I never like I guess really thought that it could interfere like with someone's sleep. You know what I mean? Like,
Mhm.
Yeah, it makes you wonder too. So like we were just talking about attention deficit disorder and medication, which is some cases are absolutely necessary. Well, that's Ritalin a lot of times. So it makes me wonder if it affects the sleep patterns for the kids and adults taking it in higher doses.
Definitely take, I have like prescribed ADHD meds, and I sometimes like I also have a little bit of sleep problems. So I do take like sleeping medication. So it's like kind of weird. I hate when I have to take them like twice in a day. I'm like popping this one and then
That
this one.
one and then
I
that
feel like
one.
I'm just not, that's not right.
Well, it's
You
better
I
to be
like-
able to function than
Yeah,
I
you're just
like to
not.
know when like my anxiety meds got like up to like the dosage. Like I was so tired throughout the day for like a week. And then I was out of them for a week and I had to wait for a refill. And then so when I went back on the higher dosage, I'm like, okay, here we go again.
Yeah,
yeah.
amazing. Well, even like I take high blood pressure medicine. And that can affect you the way anxiety medications do. So I will be dragging my butt through a week if they mess with my blood pressure medicine. It slows everything down. They're like beta blockers and different things that you'll hear that do that. And they can be brutal. So anybody, middle age and beyond, they're probably on high blood pressure medicine. And it definitely affects the way you feel and your sleep patterns and all that.
Yeah, definitely.
Mm.
I think, I don't remember what else was on it. There was so many that I was just like, oh my gosh.
I didn't realize, I think restless leg syndrome was under the
I think
sleep-wake
you are
disorders, and I did not realize that was going to be one of them.
Yes, isn't
I
that
saw
funny?
Oh my gosh. And then I was thinking like sometimes like I feel like my limbs go to sleep so quickly. Like I don't know. It's been a thing where I'm like, should I get that checked out? But I thought that when I read that was like, and then it's so funny when you're just going through the DSM, you're like,
Do I have
tell
that?
me.
Do I have that?
I like used to have like sleep paralysis a lot where like my like body would fall asleep but my brain would stay awake and it is the worst thing I have ever
Where you can't
experienced.
move, you're trapped in your body.
I've never
Yes.
that thing.
And like I start like seeing or hearing things. I had to go get like testing done at a neurologist and that's when they put me on trazodone that I just take when needed if I feel like I can't sleep.
Yeah, that's a bad feeling. I've had that feeling.
paralysis, because like someone told me what it was one time. This was a very long time ago, and that's when I realized that I did have sleep paralysis a few times, but I didn't know that's what it was, and I was so freaked out. I was like, what is happening? Like, I don't understand what's happening.
I don't like
It's
and
freaky.
well, when they explained it to me, the neurologist, it's kind of like either you're sleeping too much or you're not getting enough sleep. And so sometimes like this is because it's happened to me during the day too, like when I just like sleep too much and then out of nowhere, like I'm like almost daydreaming, but I can't move.
Hmm.
And it's because they said it's actually because you're oversleeping.
Oh,
I've never heard that before with that. Huh. That's interesting.
So it can happen for lack of sleep or oversleep is I think what they said is a common cause for it.
okay.
I think we've all just stayed awake and not been able to get to sleep. Usually for me, it's because I had a really crazy day. But I thought it was really interesting because it's never bothered me. I just lie there until I fall asleep. And I'm thinking, oh wait, I have insomnia. And then it says that if it doesn't cause significant or clinical distress or impairment, then it's not insomnia. So unless you get upset about it,
Oh my
If you're not
gosh.
sleeping and you're cool with it, it's fine.
Oh my goodness.
I don't know then, like, because I guess I have insomnia times because I do get upset about it. I'm like, why can't I fall
that's
asleep?
insomnia.
Yeah.
I do too. Well, I went and had a sleep study done once because I have sleep apnea. My husband, it bothers him way more than it bothers me. He was like, you have to go because
Like, I'm
your tears stop. I stopped breathing like for minutes during the night. And then I do
Wow.
that thing where I'm like, because I've just stopped breathing. Doesn't bother me though. I just go, okay, and I roll over and I go back to sleep. So never
Yeah.
considered a disorder. My husband was like, you're scaring the shit out of me. Please go get a sleep study done. And they were like, well, you should use that, that big beast.
mask.
Yeah,
Yeah.
I'm not
Okay,
doing
now
it.
I'm
I would
curious.
never,
Not
unless
doing
I just slept on my back for the rest of my life. But it's bad for you though to
Yeah.
sleep on your isn't it?
Yeah, I think that it makes your tongue fall backwards maybe as you relax. So you
Yeah.
should sleep on your side to clear your passageway.
They have those
See,
beds.
I've always been like told like I've heard both. Like, oh, usually people are like, oh, you sleep on your side, you sleep on your back. I'm like, how do you sleep on your back?
I love sleeping on my back.
Yeah.
I can't. Like I've tried.
I'll
Okay,
start
so I
stomach
just
first.
have to tell you, Jenna, that
Yeah.
it doesn't have to cause clinically significant impairment or distress to be sleep apnea.
Was it true? So I do have sleep apnea, even though if it doesn't bother me.
Oh
It's
my
causing my
God.
husband significant distress.
Yeah, no, it doesn't have to cause anybody. You know,
Damn it. I'm still
It
not
doesn't-
wearing that thing. I'm not going to sleep like Darth Vader. It's not happening.
Gosh.
No,
Yeah, like,
no.
how you
I'm
supposed to
capping
do
out
that?
at the mouth guard. You can't feel sexy putting in and taking out your mouth guard. The last thing
No.
I'm doing is wearing the whole Hannibal Lecter mask.
Love you, sweetie.
No.
Yeah, that's crazy. I don't know how anyone's supposed to like get good sleep with that. I mean,
Oh,
I
It is
feel like you just get
different
used to it because my dad has one and it's like nothing to him now.
yeah, he's
Yeah.
used to it.
yeah, I have like an uncle
Yeah.
that has it, and he's had to do that. Or I think I
Forget
don't know.
about sleep. I'll never get any sex again
I
with
just
that big
feel
thing on my face.
That's a different dysfunction. It's a different disorder.
the recording's still on, Jenna.
We're supposed to get comfortable talking about sex. Did you guys read that?
I mean,
Yeah,
we're gonna be talking about. Well,
Is that next week? Are we
Is
doing
that-
that?
we
yeah,
did.
we're gonna miss, although we're supposed to get comfortable talking about sex, we don't
Oh,
get
we
to
don't
actually
talk
do
about
it.
Yeah.
Yeah,
Because this is the last time we talk, but yes, there was a whole message about getting
and
comfortable.
Well, this
Yeah.
doesn't have to be the last time we talk. This is just the last time we talk for.
That's right.
True.
We'll keep sending her the tapes.
That would serve her right
We'll keep sending them in.
for the rest of our lives.
So there's just a couple other things on the sleep that really, that kind of bothered me because I don't sleep well. And one of them, it says that it's 40 to 50% of the people with sleep disorders have comorbid mental illness.
Hmm.
So
And
maybe,
now she's looking at me.
maybe start wondering what else I might
Uh-huh.
have. But and then the other one was that suicide study where it said that 31% of college kids said they don't sleep well. But the scary part of that is 82% of those same kids, 82% of the 31 said that they think about suicide. And that's all, that's ruling everything else out. It's just lack of sleep as far as they can tell. So so I think sleep is a really important thing, and because it goes through so many disorders, I
Yeah,
think that's something that
good
I
point.
want to
Don't-
make a mental
don't
note
brush it
to
aside.
ask about in the
Mhm.
when you're
Yeah.
asking, doing your interviews.
Good
Yeah.
point.
And
I think
Swara
that's good enough on
mentioned-
sleep, though.
what?
I think we covered sleep.
Okay.
Yeah,
cool.
that's for sure.
Oh, we're 47 minutes into this.
Other.
Are
Yeah,
we?
I have to go soon, but I know we touched on like the feeding and eating disorders last week,
Mhm.
but I just still can't get over this. When I was reading about anorexia, I think we had a case study, and I didn't know that there are different diagnoses based off of weight or like I guess presentation. I don't know if you guys knew that.
Yeah, I remember us talking about that last time.
It's like
Yeah.
there was one of the case studies that I was reading. I was like, well, she's anorexic and but she wasn't meeting the criteria. I don't think because she was losing weight, but she was actually atypical. And I was like, okay, this is
It's more
another diagnosis, right?
This is more confusing.
Yeah, yeah,
It gets tricky.
I know.
yeah.
And
But
Eating disorders are scary, though. They're really scary.
Yes.
there's even like a night eating syndrome, I think. And it made me think, because as I was going through the reading, I was like, I wonder if the night eating syndrome, if that's part of like a sleep wake disorder too.
Yeah, it
God.
could be related,
I mean,
right?
that's why they're right behind each other too. Like it's just
Yeah.
that weird spectrum of like, oh, it's all linked together, but like they could be separate. They could all, it's confusing.
Related. Makes
Yeah.
sense.
Sorry, I keep moving this. I can't go downstairs because it's my son's birthday and there's a big party down there.
Oh,
Oh,
goodness.
I'm trying to hold my
okay.
phone steady.
Okay, well,
I was wrong. I could see you were like in a bathroom. I don't know.
yeah,
But I was like, what is she doing in there?
just
But I was
hiding in the
like,
closet from the
background.
party.
Phone.
Oh,
Did we
well,
cover everything?
yeah, should we address anything else before you have to go?
Was it the somatic
What are
disorders?
those?
Yeah, the thematic
Yeah, what are
disorder.
those? What
That
are all
was
the
it.
things you listed? Because
Oh, and the elimination disorders, which like was funny that you were talking about the sexual ones, and I was like, well, we were talking, we've gone through that one, read that, all that stuff, and I feel like I kind of forgot about those, and I was like, oh, maybe do I really want to be dealing with that?
enuresis and
elimination.
capricis. Enuresis and capricis.
Recess.
Oh my
Kind
gosh, that was so confusing on the last.
So
Oh,
I got
yeah,
those
that
two
was hard.
questions wrong on the quiz and I was pissed.
The like urine with you, and then like the other one is just
Yes, it was
Yeah.
the one is the, yeah.
Oh, that's a
Because
good way
like
to
it was
remember.
confusing because he technically didn't meet the full
He
criteria, but
didn't
that's
meet
what it,
the full criteria. He absolutely didn't. I was so
Yeah.
angry.
because it didn't give a time like times on how many times he was
You
doing
could
it.
infer it, but it wasn't stated. And
But
that's
it was the
rule.
but it was
It
the most
said something like for at
accurate.
least 4 months, but it didn't specify like how many times in a month or something like that.
Yeah, how many times he did
Yes.
do it,
Yes.
everything.
Yeah.
And they only described 2 times. So I was like, this is not meeting the criteria. So I gave him the like other specified, but with and capricis.
Maybe I said, I can't remember what I had put for that one. I tried to like,
Wrong.
ah,
The right answer was and capricis, even though he didn't meet the criteria. And I was like, it's not right.
I wavered back and forth for so long. I'm like, I'm just going with anchor pieces, and I was right.
That was smarter. That was smart. I should have, because I was like, clearly they're reaching for this. But
I'm like, it makes the most sense, even though there's no time frame.
yes.
and that's
Ah,
what's so terrible is you have to kind of like think like, oh, like this is what we're only learning, but that's the only information we can have right now. And then the questions are like, well, based on this, like what you can see right here, it's like,
but then they threw in those other specified ones just to muddy and the other specified was like with and capricis. And I was like, okay, well, there you go. Like it literally said, if they don't meet the full criteria, but I was like, okay, no,
yeah.
they're
I
tricky.
thought it was interesting too that a lot of these things in kids, they're finding that there's often a trauma connection. And so that's something I wouldn't normally think of asking about either. But in these in particular, in enuresis and in capricis, they said that there could be inconsistent or punitive parenting or caregiving or other kinds of stress. And it might not be that, and it might be that they don't intend to, maybe the parents have a lot going on. But trauma is an underlying question that we should probably always ask when something like this comes up and where it's repeated.
It's been significantly
Actually, a
correlated.
foster daughter who when she came, she was putting like feces on the walls. And it turns out her background was just really horrendous. We didn't know about all that. But I think that I think it's worth asking, about possible past trauma and maybe from a variety of sources. Because if somebody does have any fault, and I'm not saying that they do, but if they do, they may not be giving you all the information.
Yeah.
Yeah, definitely. There's a lot to unpack, I feel like, with those type of disorders. And you just kind of know, like, it's like they're happening for a reason and probably like definitely not a good one for sure. But to briefly talk about somatic disorders, do we remember kind of what was going on with those? Those are like what the ones where you feel like something's wrong, but there really isn't. It's just like basically.
I think caffeine withdrawal was on there.
Oh my gosh, was it? I don't.
Yeah,
There's
and I
so
was like,
many,
there's
and I
no
kinda
way,
forget about
but it totally made sense.
This
What
like
was
the
that
one
that
where
one?
someone like thinks like they're like sick, but they're like not.
Mm-hmm. And
Oh
then
my gosh. This is like
But one
some
thing
people,
that I did, oh, I'm sorry, go ahead.
like
I was gonna say, like,
lunchbox.
I don't, sorry.
Munchausen's?
Yeah, I was gonna say that too. It leads into that one as well.
Yeah, because I never like knew like it was like actually like a disorder. I'm just like would always tell people like, oh my gosh, like shut up, like you're fine. Because like I like knew this person and they're like, I swear they're like, oh, I'm like forgetting stuff, so I have a brain tumor. I'm like, you don't have a brain tumor. Like shut up.
That's one of my like the backlining fears all the time when you're like getting a headache, you're like but yeah.
You're
And then
in-
there's the illness anxiety disorder too. I saw that. I was just gonna ignore it. But yeah, there's illness anxiety disorder when you're really scared about getting sick.
Yeah, I had a
Kendall
client
Jenner.
that had that. She was like afraid of going to school because she always thought she was gonna get sick and she was always in the nurse's office.
Yeah.
It's so real to them too. It's just so real. I think you have to start from that. Um, instead of trying to figure out if it's real or not, I think you just start from
It
the
is
fact that
real to them. And
it's
but there's like also like some people, as we just kind of like talked about like in our psycho farm class, the people who just like they don't take it seriously and it's like a joke and it's like, this is like an actual diagnosis. Like
what was
Yeah,
the
there
one,
was
is that the one you were talking about, the one where they actually completely fake it?
I think
oh,
that's
on the quiz.
Or is that-
On one of these somatic disorders, it's the where they're
Factitious.
trying to get insurance money or they're trying to not be liable for a crime they committed.
I
What was
forget
that
the name
one?
for it.
I know what you're talking about. I can't
Factitious,
remember the name of it.
factitious
I was gonna say
disorder.
Jenna, but I can't pronounce it.
Yeah. Deceptive behavior is evident, even in the absence of obvious external rewards. Oh, so they might just be lying for the sake of lying, so they don't have to get a reward
That's
for
the
it.
part about it too, is
Yeah.
like you just really do think that's the reality, but and they are getting the insurance money maybe, but like they're just kind of not
how
there.
is that like not a type of like psychotic disorder though? Like that's what I'm just like
Like, oh, that's true.
Yeah, well, it says they falsify physical or psychological signs or symptoms,
And
or
see,
they
that's
even
the thing.
hurt themselves on purpose.
I have to go in like 2 minutes, but that's the thing. When I read that one, I was like, well, earlier it said that all of like the client symptoms, like they're true, right? They should be treated as if they're true. But what if we know that they're lying? Like,
Then they get this other one.
yeah.
And then there's the
But do we like continue on and like just knowing that they're lying?
Then rule it out because
Yeah.
because those other ones, it's clinically significant impairment or distress, usually, in an important area. And if they truly don't really have distress or impairment, then it's not the disorder, right?
Yeah. I think we covered everything, right?
Mhm.
think
Yeah.
about point, yes, now.
Yep, and we've kind of run out of time. I know a couple people have to run, so we can close here and we're gonna meet next week, just to talk about our paper sum, right? Do you guys
Yeah.
wanna do the same day, about the same time?
Yeah, that works with me.
Good with
Oh,
me.
that's fine.
Right.
Cool. All right.
All right. Bye guys.
Bye, guys.
Bye.
Bye,
Everybody,
guys.
have a great week.